Hi there, Dr. Henry and Minister Dix. I just wanted to ask you how concerned you are about parents now planning to protest current safety protocols in BC schools by keeping their kids at home tomorrow as a day to say that, safety protocols just aren't strong enough for them.
Oh, I hadn't heard that. These are absolutely things that are done on a local basis. The teachers have been involved, the school communities, and so I think the parent voices are very important to ensure that what's happening in their school community meets the needs of parents and children. But you just want to reflect on this. We've had very little transmission in schools. We've had many exposure events, but they have very rarely resulted in transmission, particularly from children to anyone. So this is an important time for all of us to reset, learn from what we have been through in the last few months, to make sure those communication is ongoing and make sure that parents are involved in those discussions as well.
Do you have a follow-up, Marcella?
Yes, just regarding the outbreaks that have led to so many people dying over the weekend, can you please explain what is specifically being done to contain outbreaks at places like Burnaby Hospital and Tabor Village Seniors Home in Abbotsford?
Yeah, there are a number of homes. I have a list of them here where we've had quite extensive transmission within those homes. There are teams that we have in place, and in those in particular, Vancouver Coastal and Fraser Health, they have teams with infection control practitioners, with additional both operational support and staff support to try and get ahead of the virus. There's testing that's done on a routine basis. Residents and staff in those homes. So we do have very detailed outbreak protocols. It just shows us how challenging it is. This time of year is part of it. It spreads much more quickly this time of year, and it can spread so rapidly in care homes that it's very challenging to deal with these outbreaks. We've had a lot earlier on in the fall where it was a single healthcare worker that was noted, or a single resident, and we were able to manage it very quickly. But once it starts spreading within the care home, it's very difficult to find people, even with systematic testing, which is done routinely of all residents in the affected area. So it reminds us of the tragedy and the terrible toll that it's taking on those who are most vulnerable. And I think of this weekend that there was the oldest person who died from COVID this weekend was 103. And you think what that person has gone through.